Welcome to the Physio Standard, a global podcast for physiotherapy clinic owners and practitioners who want to lead, not follow. Each episode explores the thinking, systems, and decisions behind world class practices. Presented by Eagle Pro, supporting modern physiotherapy clinics worldwide. In today's episode, we discuss the challenges of scaling physiotherapy clinics beyond the founder, especially while managing multiple locations. Joining us today is Dr. Ravi Ranganathan, founder of Pain and Stroke Rehab Center, Chennai, who brings real world insights on building scalable, high quality practices. Welcome to the Physio Standard, Doctor. So, my first question to you is clinics often start with a founder's passion and a personal way of thinking. So, what happens in such a situation where more therapists are added, and how do systems help to manage that transition?
Normally, kids, when they get started, they start out of passion. I know somebody wants to do something differently in the community, and then they come up with a plan. They will have certain ways of looking at things, and they will want to establish that. And then they are the ones who have the fire on making this run. Okay. Anytime when you hire a second person, it immediately adds like a different tangent of thoughts. Okay. It's almost like getting married to a girl who you don't know. Okay. So they would have grown from a different economic and lifestyle and a different way of hygiene. And even their problem solving methods would be a whole lot different from what you would be doing and which college you went to, how you were groomed, where you got your experience, all those things matters. And anytime when there is another person, then it messes it up big time. So picking up the right person is very, very important, and spending a lot of time to identify that person is also necessary. And yes, it is a huge challenge at hand. When there is a system, it is supposed to make sure that the thing runs smoothly. It will not be a fixer-upper of everything. We have to be very clear on that. I have to be honest on that one. However many systems you place, our profession of physiotherapy is a personal interaction-based profession. So how I work with someone or how I motivate someone will be entirely different from how somebody else does it. Okay? So I wouldn't call that wrong, but it will be quite a lot different from others. So yes, systems will help to control that errors to the best possible. And that also standardized the systems is a better option other than you having a certain set of rules. Okay. You can have your set of rules on top of standardized systems where standardized systems is required. That way you will be standardized to others in the market as well, according to evidence. Else, if you're going to set a standard according to your visual will, then let's say somebody else comes and then changes it, there will not be a structure to look up to and then see whether your thought is right or his thought is right. So we have to have a standardized everything so it will be even and it will be acceptable also.
So next, I want to ask you, when you have three centers in Chennai. So when you scale to multiple locations and many therapists are working and they have different levels of experience, how do you ensure consistency of care while you are still letting them grow and make independent clinical decisions?
We have a system where like a senior does the evaluation and then we establish goals and then a plan of care. So we want all our therapists to follow that and follow the plan of care. And at the same time, they are also given the chance to evaluate a new client and then come up with a plan for themselves also. That way, they get tuned to doing evaluations in the future and then establishing a plan on their own and also educating the others. Okay. And this educating the others is something which I have used here in our place where the senior therapist, me or anyone who is next to me, does the evaluation and also like educates the newcomers on how to do the evaluations and how to establish the plan of care, and if something goes wrong, how to reach out to seniors, and if nothing works, how to reach out to me to ensure that the idea is not missed out and the client does not get lost. And at the same time, the company's bottom line should not be lost. At the same time, the consistency has to be maintained. It is a tedious process, but there are some physiotherapists who will immediately come and then seek help. Some of them don't. That is where I run into problems. By the time I realize the damage is already done in some situation, okay, but it has to be monitored all the time. Like I said, if there is an admin to ensure that all these routine stuff are documented, and like if there is inconsistency, then we have to sit one-on-one with the therapist to identify what his concerns are. Sometimes there are some people, one example was there was someone who knew exactly what to write, but he was not confident with the grammar part of it. Okay. This is something simple. If he had told me, I understand, okay, communicate whatever you want, grammar did not matter to me anymore. So that one he was so afraid of, so he did not document it for a long period of time. I realized that late. Only when I sat with him, I realized it, and then I started correcting him, helped him out a little more. That extra time is needed for some folks. We have to do that to ensure consistency.
From an owner's perspective, what challenges arise in trying to keep the care consistent when patients move between multiple therapists?
When there is only one edition, it is about me and that person. I can influence them and they can be influenced by me. So it is easier. The moment there is a third person or another bunch of people around, you never know who is leading this group. Okay. So, and you would have told them a certain rule, and then that would be perceived differently by another person according to the way he was raised. There's no right or wrong thing here. Okay. But if they perceive it a certain way and then they explain to their peers, and if they all start believing that, then yours and theirs gets even more complex. Okay. Yes, the more the numbers you go, the harder your complication is. And having standards like outcome measures has helped me quite a bit to help standardized care was great extent, but still it is not a fixer-upper of all. Like I said, in physiotherapy, there is not just the human body, okay? The human body, the systems, how the therapist works, and how the environment is changing from the structured clinic environment to the whole. So many factors are there. So all these things have to be integrated by the physiotherapist. Only when they understand the gravity of the situation, then it works better, especially when there are two or more therapists. If a client goes from one to the other, there will be conflicts even there. In fact, she did it one way, I did it another way. It is hard from a employer's perspective to just streamline everything, because I cannot say this is what we do, this is what we do. Then it becomes protocol. Our physiotherapy profession is not protocol based. It can never be protocol based. It has to be very much flexible according to the client's expectations, client's needs, and the family's environment. How much will they be able to pay? How long they will be able to come? So many factors. We have to consider them all and then come up with something which, if you want that to be standardized, very difficult, but still doable to a certain extent. Yes, if we put your heart and soul to it, yes, we can do it.
So, next, I want to ask you, why is it difficult for clinic owners and founders to step back from day to day activity, even though they know that that is necessary for growth?
Okay. Stepping back is a great idea. When you look at it, it makes you feel like, yes, I'm growing from being a one-person center to a bigger setup, and I'm having more people working for me. Dream-wise, it says I'll be making several times as much money as what I did. Technically, it doesn't work that easily. Okay. And the reason being, like I said, physiotherapy is a interpersonal relationship business. So, how easily I can get the confidence of my client is much different from how easily someone who is novice, yesterday's graduate can get in. So, is that wrong on their part? No, but it takes some time. And to see a client being treated by a novice therapist is the hardest part, I firmly feel. When you would have done it just like that, and they would be like struggling, you would want to help them, but like you won't be able to barge in just like that because you want to give them that professional dignity of making a decision on their own. And it is a very tight situation. And if at all they lose their client, my business is going to be at loss. I cannot afford to have that either. If the client goes home thinking like my organization is not the best organization in the world, then I lose business on it. I cannot afford to do that. So it is very hard to step back and then allow them to work. It is a tightrope, and sometimes you get mad. Sometimes like you feel like turn them around and then like throw them out the window. But yes, we have to do it. It is a very hard decision to make, and and it does not settle. By the time you think you have trained someone and then got it all straightened out, then there'll be a change attrition, and then like you start the process all over again. You have to learn to do this and live with it without complaining, because it does not tend to complain.
So we are seeing a change in patient expectations these days. Everyone wants convenience and they want faster outcomes. So how does that change the way that clinics need to be structured internally?
Earlier, science of physiotherapy by itself was not grown very well. Now it has become much more diversified, and the structure which the organization gives, or the associations everywhere give, has given us specific guidelines on how to do it. That has made things much, much simpler. But still, there are so much fluctuations on how we structure it internally for having a standardized care. Okay. Um, Even with a lot of education, training, and repetition of things, if we leave it completely to them, to a entry-level physiotherapist to decide on themselves, it becomes so hard on them. I don't blame them, so hard on them. And at the same time, some people are able to absorb things easily from the others, and some people are not. They need some structured training. So structured trainings are important on what the values are of your clinic, right? Because the original owner or the person who started it would have thought with some dreams and some ways of working out, and the way he would have structured it, he would have integrated his thoughts and then done it. And with time also, there will be some modifications, but the core value will not change. Okay, the core value has to be maintained. And getting a therapist aligned to that and then making them do it is the hard part. But once the therapists understand it better, then it starts flowing well. Okay. And many times, what I have found is that if a bunch of internees come to us, okay, when they work with us, some of them latch on to us with so much enthusiasm because they like the way it is done here, and that's what they want to do. When you hire those kind of people, they are in tune with yours, so educating them is much easier, and that structure makes it a smoother transition. If the thought process is entirely different for them, and then you hiring them, you will spend a lot of time training them, and that will not sink into their head at all, because they are raised differently and they will not be able to comprehend what you're trying to say. And yes, structure is thing. And the demands people place now is entirely different. Earlier, for an outpatient center like ours, people are willing to come for long periods of time, but not anymore. Everything is delivered home. People want everything at their home and at their comforts. They want everything provided under one roof, which is not easy. And even if we try to provide, managing that all becomes like too much of a hassle, where like you are not doing physiotherapy anymore. You're doing more of administrative stuff, where like trying to get the watchman come in, help come in, food come in. This is not at all working out. So I'd say the fine line on we can have a structure in terms of what physiotherapy we can do, okay? But some things are not under control, our control, so we need to have hired help who are trained to do that. And even administration becomes a headache when you have like too many people and too many thoughts, and having some structure helps. At the same time, somebody to monitor that structure is needed. Okay, as a physiotherapist individual, you are not made to do admin stuff and clinical stuff. It is good to spend some money on admin and then move that responsibilities over so it gets done well.
If you look ahead, how do you see patient expectations, demographics, and technology reshaping physiotherapy? And also, how should clinics start preparing for these changes today?
The dynamics of the expectations, not only of the clients but their families, is changing every day with the advent of new technology and kids moving away from their hometowns and parents struggling on their own. And the population, today's newspaper was telling that the population is going down, the younger population is going down, where the older population is going to be higher in the future. So the demand for physiotherapy is going to go up while the number of physiotherapists ready to help will be less. And the expectations from the clients would be like, you cannot expect family to be there to help them. So it puts an additional burden on how they're going to solve this puffy kind of thing. So that is going to be more in the future. And when the demand goes higher and the population is less, the costs are going to go higher. And how are the old people going to handle that is a big question. Anticipate a lot of problems in the future. And uh, for clinics to catch up with it, I would say, since the profession is growing at a very rapid pace at this point of time, keep yourself abreast with everything you can, use technology as much as you can, and try to standardize procedures. So, even if you're not able to go to everyone for the length of time you want, okay, you should be able to give them some information which they can continue at home and then come in once in a while. Transportation is becoming a headache. So if clients are not able to come to your place, you should be able to use tele consultations to let them out and make them come only once in a while. Those kind of adjustments, and I don't know, I'm thinking of whatever this current, okay, we may have newer expectations and newer challenges with days to go with artificial intelligence coming in. There is a lot more questions AI gives you. And with that, you should be able to keep up with whatever that is giving and answer the clients. If they have already browsed the artificial intelligence and they have better answers, you have to catch up with them. So those are all challenges, and I don't know how much AI's influence will be on our profession, and it's going to be so dynamic. I'll be waiting to see what things are going on, and it's not going to be easy, but challenging. I would say it is challenging, but it has been tough all the time. It would be remaining tough when you have to face the consequences and then be flexible enough to change, move on.
Thank you so much, Ravi sir, for your time and for sharing such practical insights with us today. This has been a truly valuable conversation, especially for clinic owners who are looking to scale with clarity and confidence. And thank you, everyone listening. You've been tuned in to the Physio Standard presented by Eagle Pro. We'll see you in the next episode.